Hello, good evening, everybody, and welcome to webinar number 2 in my Women's Health series that I've kicked off in this lovely month of May. Tonight, we are going to be talking about all things menopause, managing menopause. This is something that I see a lot of women for in my practice, and I feel very fortunate and proud to be a naturopathic doctor in this sense, to be able to provide you ladies with so many tools and options to help you truly get your life back, because I know that that's a common theme and a common shared thought that a lot of women express to me, that this transition happens and all of a sudden they don't recognize the woman looking in the mirror. They don't recognize, the body they're looking at or how they're feeling or what's going on in their life. And we spend at least a third of our lives as women in menopause. So it better be some damn good years. And I'm here to help you through that. So let's dive right in. Let me just change the slide here. Okay, so on the agenda for this webinar, I'm going to take you through your hormone roadmap. Then we're going to go through understanding your symptoms, so from the physical, emotional, and cognitive sense, putting yourself first, why prevention and taking care of yourself is so important now more than ever. A naturopathic approach to managing menopause, so some of my foundations to treatment. I'll dive into bioidentical hormone therapy, if that's something you haven't heard about before. You might find it interesting. And then I'll be talking about a special gift for you that I have as a thank you for taking that next step into elevating your health and to making empowered decisions about your healthcare. So your hormone roadmap. I always love to show this diagram because it demonstrates during the typical reproductive years of a woman, the expected rise and fall of her hormones every month. So we have day 0, which is the first day of bleeding in a menstrual cycle, day 14 on average, which is ovulation, and then day 28, the last day before the next bleed, before we start it all over again. So as you can see, we get that typical expected nice rise and fall that we strive for in the average cycle of a woman in her reproductive age. And then contrasting to this graph, which is the hormones leading up to, during, and after menopause. So you can see lots of falls, rises, dips, flows, all of these things that happen. And as the age, as age increases, so from 35 to 45, 55, 65, etc. So women often tell me, I feel like my hormones are a mess. And I'm here to tell you that it's true. They can be a mess, but luckily I have some tools and resources to help you through that. So, and just to kind of define the different stages that you go through as a woman. So perimenopause is that time 10 to 12 years before menopause itself. So this can happen as young as 40 years of age, even 38, 39 in some women. And this is when you're most likely to experience that roller coaster of symptoms that I'm going to get into. Natural menopause is life after your last period. So it's after you've had one full calendar year after your final period. And this is when symptoms start to settle. And the average age worldwide is 52 years of age. And this varies. Surgical or medical menopause, it can occur at any age. So that's when you may have had a complete hysterectomy. So that's if you've had your uterus, your cervix, that's when your ovaries essentially, in addition to the uterus or cervix, has been removed surgically. If you've had chemotherapy that has put you into medical menopause. So that can happen at any age. And hormonal changes that happen. So estrogen and progesterone are our 2 main reproductive hormones that I'm going to be talking about in terms of how they contribute to the symptoms that you experience. So estrogen in particular, in perimenopause, we like to think about estrogen on that roller coaster. So it can go very, very high. So sometimes even double the amount of that in a normal cycling woman. And it can crash. So it can decline really quickly too. So these huge roller coasters, ups and downs, really can contribute to hot flashes, night sweats, mood changes, essentially anything drastic, anything that I'm sure if you're there, then you know exactly what I'm talking about, this estrogen roller coaster. And eventually estrogen is on its decline out. So that's the general trend that it takes. Although it's going through that roller coaster, the general trend is that it's declining. And that decline in estrogen leads to thinning of your vaginal epithelium. So we get a lot of vaginal dryness, pain with intercourse, pain or urgency with urination, more frequent UTIs. You can have vaginal prolapse as well. So we can thank estrogen for that. Another interesting tidbit I like to share is that declining estrogen also contributes to production of wrinkles on our skin. So skincare is another passion point of treatment for me. And it's interesting how our hormones play a huge role in how we age and how we see that on our face. So we can thank those declining levels of estrogen for further contributing to the decline in collagen and elastin that keep our skin nice and plump. And then we have progesterone. So it does not follow the same roller coaster that estrogen does, but the general trend that it follows is that decline that happens. So it's quietly exiting the scene. Now, because estrogen and progesterone, they are very much a yin and yang, and we like adequate levels of progesterone to balance out that roller coaster of estrogen. You can imagine if estrogen is on its roller coaster super high one day or over a certain period of time, and progesterone is slowly declining, that decline of progesterone is only going to further enhance those symptoms of estrogen excess that we don't want, that are the most difficult ones to deal with. So understanding your symptoms. So in those perimenopausal years, a lot of things that are going to be changing for you. We get those flooding 40s, very, very heavy periods that come on almost suddenly, hot flashes, anxiety, depression, insomnia. These are a few of the standout ones that occur anywhere from 10 to 12 years, sometimes less, but you could be experiencing these for almost a decade before menopause actually sits in. And then menopause itself. So that transition from your final period to that year and those years after. So yes, symptoms should start to settle at this point, but still very prevalent are maybe those physical and emotional and cognitive symptoms. So hot flashes, night sweats, irregular vaginal bleeding, vaginal dryness, breast swelling and tenderness, water retention, weight gain, headaches, frequent UTIs, bone density loss that can ultimately lead to osteoporosis, dry skin, loss of elasticity, low libido, joint pain. We also see insomnia, irritability, depression, anxiety, mood swings, memory changes, decline in motivation, impaired arousal, a decreased sense of well-being, energy, and ambition. So as you can see, not only are we having those significant physical changes, but a lot of emotional changes as well. And this is why at such a tender time in your life, I feel very fortunate to be able to work with you to help give you that zest back, help give you that life back that you deserve to thrive in these transition years and beyond. So contributing factors in your health that can determine how easy or how difficult your transition in menopause may be. These are a few that I see clinically. So if we have issues with thyroid function already, that can change. Especially we see a lot of disturbances in the perimenopausal years with that flooding and onset of very heavy periods. We need to take a look at the thyroid in that sense. Adrenal fatigue, poor stress management, the hypothalamus pituitary adrenal axis dysfunction. If you have a pre-existing autoimmune condition, insulin resistance, impaired detoxification, gut dysbiosis, inflammation, all of these factors can contribute to how you are transitioning through menopause. Now, this is a question I get a lot if I have women in my practice who have had a hysterectomy. So they still have their ovaries, but they've had a hysterectomy, either removing the uterus or the cervix or both. And how do we know? You're not cycling, you're having a virtual period. Some women feel a change in mood. They see a change in their body. They are able to really be in tune and notice a cyclical change of their symptoms every month. So I'm an advocate for that, track in a month and see if you're noticing any cyclical change without the bleeding, of course. But blood work is really useful in this sense. So FSH, or follicle stimulating hormone, that's something that rises as the production, or as your ovaries tend to shut down in a sense and stop ovulating or producing a mature follicle to release an egg. So as FSH rises, that's an indication of where you are at in menopause. So FSH over 40 in the blood usually tells us that you're there in menopause. Now, putting yourself first, something I am such an advocate about. Preventative care is so, so, so important, not only for women in menopause, I would argue women in general, which is why treating women is such a passion of mine. And I really strive to provide so many resources and information so that women can make empowered decisions about their health. And it is important to note that during and after menopause, women are at risk of developing things like osteoporosis, cardiovascular disease, diabetes, high cholesterol, dementia, weight gain, thyroid issues, arthritis, depression, and anxiety. So these are big things that if we're not being preventative, if we're not having them on our radar, we can certainly amplify the other health effects and risks that come along with them. So it's important to note that as a woman, if you're, going through these transitions, taking care of yourself and putting yourself on that front burner is important now more than ever. And to go along with this preventative care, as a naturopath, this is something that I preach. I'm always looking to prevent and to amplify and optimize your health so that we're not running into these issues down the road. So things that I do in my practice and that I advocate for women to do are to get those yearly blood work numbers done and to compare and make sure that we're tracking changes and catching on to see if there's any shifts early. So this is my wish list of what I would love for every woman to have in my practice every year at least. So a CBC, looking at your blood cells, your ferritin, your storage levels of iron, HbA1c, which is a measure of your blood sugar over the past 3 months, fasting insulin, vitamin D, vitamin B12, a full thyroid panel, liver panel, looking at your liver enzymes. So they look like things like AST, ALT, or GGT, kidney function, cholesterol panel, and your hormones too. So we can test your hormones through the blood, through your saliva, or through the urine. And I have a specific section on testing hormones in particular in my previous webinar that you can find on this Facebook page, and I'll be uploading it to YouTube at the end of the month as well. So if you're curious about more methods of hormone testing, then feel free to refer to those videos, or you can ask me too. I love talking about hormone testing. In addition to getting some numbers and levels done, it's important that we're keeping up with those pap smears, whether you're on the 1-year track or the 3-year track, making sure that you're following the recommended guidelines there. As a naturopathic doctor, I am able to perform pap smears as well. So if you'd feel more comfortable coming into my office to have that done, I'd be more than happy to have you and to be able to provide that medical service for you. Following up with your mammograms or breast ultrasounds, your bone density scans are important, colonoscopies. And I always advise for women to go see a pelvic floor physiotherapist. So if incontinence is something that you're struggling with, if you've never really felt right after giving birth, if things are starting to prolapse, pelvic floor physio is wonderful and can do wonders for helping you get everything working well. So I have some great referrals and people to refer to if you want to reach out and ask me about that. Okay. So a naturopathic approach to managing menopause. So here I've outlined my foundations of health and what I'm looking at in a woman who presents to me in perimenopause, in menopause, or those years after, what I'm looking at in her health and what needs to be optimized or what we need to make sure is working cohesively. So we need to be looking at gut health, blood sugar, or your adrenal glands, your inflammation, and your detoxification. Of course, this is all individualized. So You may have some more emphasis on blood sugar and insulin resistance than somebody else, but this is the beauty of working with a naturopath, is so that holistic overview of your health and that patient-centered care. So making sure you're getting the exact care that you need to meet your needs. So we'll start off with gut health. So we should know by now that healthy gut bacteria are so crucial to overall health. And I'm talking about your microbiome, those probiotics, those good bacteria that help repopulate your small intestines and your gut. And they are not only important for gut functioning, digestion, regular bowel movements themselves, but by having regular bowel movements, we're able to safely escort estrogen out of your body. So if we're experiencing a lot of symptoms of estrogen dominance, so breast tenderness, weight gain, those heavy periods, even cramps in a menstruating woman, we always need to look and see what the bowels are doing, what the gut is doing, to make sure that you are having regular bowel movements to get that estrogen safely out of your body. Healthy estrogen metabolism, when we're putting that into play, it really does help relieve those symptoms that I previously mentioned. So that breast pain, that irritability, all of those things. Okay. Now, blood sugar. So I borrowed this diagram from my lovely colleague, Dr. Molly Sears, because I absolutely love it. But we look at blood sugar in particular for the role that it plays in weight management. And specifically on this diagram, I want to talk about the hormone insulin, so your fat storage hormone. So whenever you eat, your blood sugar is going to increase, so that blood glucose level. This signals your body to release insulin, so that insulin brings the sugar out of the blood and into your cells, stores it in your fat cells. There's a phenomenon that happens called insulin resistance when your cells become less sensitive, so they're no longer communicating and talking to insulin like they used to. When this happens, we're in that feedback, so we're producing more and more insulin. The more insulin your body produces, the more fat your body stores. So it is really a fat storage hormone. Insulin also disrupts normal functioning of your cortisol. So we're going to talk about your adrenal glands as well, but that stress hormone, it interrupts thyroid functioning. It interrupts general hormone balance. So insulin and regulating it through blood sugar is certainly something that I always look at when we're treating any symptoms that have to do with perimenopause or menopause. So how do we balance your blood sugar? Some great ways that you can start doing this in your diet are to avoid refined sugars and processed carbohydrates that are oh so delicious, but so difficult for our body to truly digest, and they really don't do much good for our cells, unfortunately. And instead, you want to replace those with slow carbohydrates. So rolled or steel cut oats, quinoa, root vegetables. Increase your healthy fats. So a lot of olive oil, avocado, nuts, seeds, nut butters, lean protein at every meal. So whether you are a meat eater, a vegetarian, or vegan, making sure you're having those sources of healthy proteins and plenty of leafy greens and vegetables. Now moving on to our adrenal glands. When I'm looking at your adrenal glands, I want to make sure we're optimizing that diurnal rhythm of cortisol. So cortisol should be at its highest in the morning and then have a natural fall before bedtime to help you sleep, which is something that I often talk about. So this not only improves your sleep, but it improves your energy. It can encourage a healthy response to stress, healthy stress management, and it helps with weight management as well. So this diagram on this slide is a snippet of one of the tests that I use, the Dutch test through urine, that can give us that 4-point cortisol measurement. So looking at what your cortisol is doing throughout the day, you can see these red lines here. This is this patient, her adrenal glands are tanked, and she is not sleeping well, not feeling great, having some weight gain, all of the above. So getting a sense for what your adrenal glands, what that cortisol is doing can really help us guide treatment. One more thing about the adrenal glands. So I am going to be talking about the ovary, adrenal, thyroid axis, which is something that is foundational to overall hormone balance. That's going to be the whole topic of my webinar next Wednesday. So feel free to tune into that one if you'd like more information. And of course, inflammation. So inflammation is a big term, but essentially it is anytime our body is perceiving stress. So not only that mental, emotional, physical stress, but chemically in our body, if there's any oxidative damage, if we have food sensitivities, if there's chemicals and toxins, hormonal imbalance or poor sleep, really anything that's causing an immune reaction to produce inflammation, deposit those inflammatory complexes, and preventing the way that we optimally digest and absorb our nutrients. All of these normal processes can be affected by inflammation. So by reducing it, we're able to help preserve strong bones, a healthy heart, healthy mind, among other things. But these are certainly things that, as I talked about prevention and preventative health, we want to look at ways that we can truly preserve good health, not only for our hormones, but for all of our other bodily processes too. So the closest thing to adopting an anti-inflammatory diet, I do a lot of food sensitivity testing in my practice. So that tells us what your reactions are on an immunological level to a certain food. So essentially how much inflammation is being caused when you eat certain foods. A Mediterranean diet is very, very close to a general overall anti-inflammatory diet because we're putting the focus on a lot of vegetables, lean proteins, healthy fats, so olive oil, fish, these types of things, really limiting our cheeses, our sweets, and our red meats. And detoxification. So general ways that you can detox are cleaning up your environment. So I talk a lot about eliminating endocrine disrupting chemicals or toxins from your environment, supporting that liver, hydrating, eating whole foods, and sweating at least once a day. And particularly when I'm looking at detoxification in a sense of what we can do to help support those menopausal, perimenopausal symptoms, I want to see how your body is metabolizing and detoxifying your hormones. So this is a snippet from another test, that same test, actually, the Dutch test through the urine. I use another test called the Comprehensive Hormone Insights test, and we're able to see how your body goes ahead and metabolizes and detoxifies your estrogens. So if there's a block at any of these levels, it certainly can be contributing to symptoms of hot flashes, brain fog, mood changes, weight gain, night sweats would be another one. So something certainly to look at, and making sure that we're filling in the blanks and putting in the support that we need at each step to safely and effectively get those hormones out of there so they're not getting recycled, they're not causing any damage, and we're helping the whole picture. So bioidentical hormone therapy, this is something I love to talk about. It's something that I'm able to prescribe as an additional treatment if needed. And I can prescribe bioidentical hormones in the form of creams, so transdermal creams that are absorbed through your skin. So when we might consider estrogen or progesterone, I always look at baseline testing to see where your hormones are at, and then we can adequately identify what dose and what method and how to prescribe hormones safely and effectively for you. If you've never heard of the term bioidentical hormone, a bioidentical hormone is one that is identical in structure to your body's own hormones. So it would be identical in structure to the progesterone that you would otherwise produce after ovulation, or the estrogen that you would produce, etc. So identical to your body's own structure of hormones, to really enhance and help support any deficiency or lack of. So when I would consider estrogen in a bioidentical form would be for mood, sleep, hot flashes, or vaginal dryness. So we can actually use estrogen vaginally to help with that vaginal dryness, recurring UTIs, things like that. And progesterone can be very effective for migraines. Once again, those hot flashes, night sweats, and sleep. Okay, so I hope that helped to get your gears going and give you some tools and resources that you can start to put into place. If you're going through menopause, if you know somebody who's going through menopause, I have a lot of daughters of mothers or, telling me that their mom needs some help right now. So hopefully you can share this with your mom or your aunt or your sister or yourself to give you some, a resource on where to get started, where to go next, and how you can start managing your menopause. So I have a gift for you that can help identify where some of your hormonal imbalances might be at. So I have a free menopause type questionnaire. So it's a 2-page questionnaire. You go through and answer yes or no to certain questions, tally it all up, and then it'll give you an idea of if you're estrogen deficient, progesterone deficient, testosterone deficient, or if you have an androgen excess. So it's a great starting point to get an idea of what your symptoms are telling you themselves. So it doesn't replace the need for blood work or any testing if we feel that that's a reasonable next step, but certainly a great place to kind of get your symptoms out there and see exactly what your body is telling you, a great starting point. And as part of my whole women's health webinar series, I am hosting a giveaway. So I am giving away a free visit, so initial or follow-up if you are an existing patient of mine, plus a 10% discount on a saliva or urine hormone test. So this is about a $250 value as my gift to you, once again, for celebrating your choice in choosing to elevate your health, take that next step, and to start to regain balance in your life, and as an appreciation in choosing me. And I thank you for doing that. So to enter the giveaway, comment on this video. So you can post a little comment in the comment section on my Facebook group to let me know that you've tuned in, and you will be entered. You can enter as many videos as you want. So in all 4 videos you can post, and I'll be announcing the winner on May 31st. One more slide here. Okay, so I have 2 webinars left in my series. So next Wednesday, May 20th, we'll be talking about the ovary, adrenal, thyroid axis. And on May 27th, the following Wednesday, Radiate from Within. So I'll be talking all about skincare, skin health, and what you can do to get that glow. They'll be happening at 7 p.m. in this Facebook group, The Wellness Collective. Hopefully, Facebook will let me go live so I can have some interaction with you guys. But I look so forward to seeing you there. Feel free to send me a message or any comments if you have further questions, and have a good evening. We'll talk soon, guys.